Everyone wants to be able to see perfectly sharp and clear and see everywhere without glasses. But that lens just doesn't exist. There's no perfect lens that's going to give you perfect sharpness and clarity and total freedom from glasses for every situation. So then it really comes down to, well, what is the priority? And I love that we're using that word because it has to be about where do you want to make a trade-off? Where do you want to make a sacrifice? So Gary, how can our listeners prepare for their cataract consultation? One of the things that I think might be nice for them to do is take like an inventory of what their life is and how they use their eyes in their daily life. How would you guide them in doing that?
Yeah, I think it's hard for patients when we say, well, do you like to see up close or in the distance or intermediate? I think the reality is we all need all of our vision all the time. And so it's kind of hard sometimes for patients to say, well, I just want this, that, or the other. But to the extent that patients can come in and know what their priorities are, I think it's important. So if you're an avid golfer, we need to know that. Or if you do needlepoint 7 hours a day, that's important. If you're on the computer a lot. So it's really for us to be able to customize a plan for you or to advise you on what, a good set of lenses or outcomes would look like for you. We really need to know what's most important for you. Also, how much do you drive at nighttime? That's I think really important. That sometimes gets lost in the conversation, not just near, intermediate, and distance, but how do you talk to patients about nighttime priorities?
Yeah, I think just as you highlighted, it's important for patients to really take an inventory of what their priorities are, but also what they're accustomed to, right? What is their job or their life demands of them? Do they have to work up close all the time, or do they have to be driving at night? Are they truck drivers, or are they pilots? In Los Angeles here, we have a lot of theater actors or movie actors and such. And so, believe it or not, that's an important conversation to have. And the reason for that is because if someone, for example, really prioritizes or wants to have the most crisp nighttime vision, some lenses have trade-offs. As an example, extended range lens or multifocal lenses, they are fantastic in giving you range of vision and freedom from glasses. But as a trade-off, you may have to be okay with having some halos around lights at night. A lot of patients, of course, when they come to us for cataract surgery, they already have halos in their vision, and they say, but doc, that's the whole reason I came in. And I explain to them, it'll be an improvement with a multifocal lens and an extended range lens. It'll be an improvement over the halos you have now with your cataract, but you'll gain range of vision. And so it's the nuanced conversation, but most definitely, I think it's important for patients before they come into their consultation, think about how do they use their eyes, how do they use their glasses and contact lenses, at what distance do they spend most of their day, and where do they want the crispest vision, and if nighttime vision is important for them.
Yeah, I think, like you said, Gary, everyone wants everything. Everyone wants to be able to see perfectly sharp and clear and see everywhere without glasses. And if we had that lens, obviously all of us would use that lens for everybody, but that lens just doesn't exist. There's no perfect lens that's going to give you perfect sharpness and clarity and total freedom from glasses for every situation. So then it really comes down to, well, what is the priority? And I love that we're using that word because it has to be about where do you want to make a trade-off? Where do you want to make a sacrifice? And for some people, the easiest thing for them to trade off is using a light pair of reading glasses when doing really fine near work or doing, something in dim light or needlepoint or one of these like really highly detailed near tasks. Maybe they're willing to put reading glasses on for that, but they really want that great distance vision, functional near vision, where if they're out, looking at a menu, looking at a price tag at a restaurant and they want to be able to see a menu, they don't want to have to put on glasses because it's going to make them look old, right? And so I think that's where it becomes really important, knowing what your priorities are. For example, the Hawaii version of the analogy you gave or the patient type you gave is that we have a lot of really active patients who are outdoors, doing ocean activities, surfing a lot, playing tennis, golfing, those sorts of things. And they really don't want to have to rely on glasses for those activities. But when they're at their desk working, maybe they're perfectly fine putting a pair of glasses on while they're at their desk because that's a lot less cumbersome.
Yeah, I just want to say one thing. We do talk a lot about glare and halos when we prepare patients if they're going to have a multifocal lens or an extended depth of focus lens. But don't underestimate your ability to get used to those rings around lights. It used to be that I was very hesitant to maybe recommend some of these lenses, and they have gotten better. All of them have gotten so much better over time. So we're really spoiled right now with a lot of good options. But I've been really impressed with patients' ability to we call it neuroadaptation. And it's not that the halos necessarily go away, but the analogy I use for patients is it's like if you're sitting in a room and you're hearing like a fan in the background, you unless it turns off, you don't really recognize it. And so I'll be sitting in a room with a patient and I'll be explaining glaring halos, and there'll usually be a register with some air noise. And I say, did you notice that air noise before I mentioned it? And they say, well, no. I said, but you can hear it, right? I said, yes. I said, that's exactly what happens with glaring halos. It's that you can still possibly see them if you want to focus on them, but if you train yourself to ignore them, they just blend into the background. And once that happens, that's where the magic is with these lenses. It's that it really does unlock so much freedom for their lifestyle. And even with driving at nighttime, I find that most patients don't really have a problem. Now, there's about 2% of the patient population that just can't make that leap, and that's okay if that happens. There's alternatives, but I've been just so impressed when patients can be patient and let their body adapt to these new lenses, how well they really see.
Yeah, I think that's a really good point, because if a patient doesn't know to expect it, then they think, oh my God, something is wrong. I see these halos. But I find as long as we do a good job educating our patients beforehand that they're going to see them, they are normal. They are part of the design of the lens. If you see the rings around lights, it means that also your lens is working and it's giving you near vision without glasses. And so if they can learn to tune it out and learn to ignore it and just trust in the process, then it's much more likely that they're going to adapt over time. The other thing that I really love that I learned from you, Netta, is when you explain to a patient who has a cataract what, say, like the sharpness of vision from a light adjustable lens, for example, would be compared to multifocal. You do this thing where you use your hands. I think you know that you do this, and you'll say, well, your vision is here right now. This is how impaired your vision is. Maybe a light adjustable lens would take you to here, and a multifocal might take you to here. So it's a little bit of difference. And if you go from down here to up here, are you really going to know the difference of what this tiny little bit is that you were missing? You probably aren't. You're probably going to be thrilled with how much better your vision is, how much better the colors are, how much more vibrant everything is. And oh yeah, maybe I have these little bit of halos that 95% of people are either minimally bothered or not bothered at all. You're probably not going to care. We spend all this time talking about it because we don't want people to be surprised, but it's not a reason not to get one of these lenses. If you're really excited about the potential to try to see as much without glasses as possible, maybe you won't be 100% glasses free, but say 95% glasses free. If that sounds appealing to you as a patient, don't be afraid of the halos, because like you say, 98% of people are going to get used to them eventually.
And the reality is, if a patient is a good candidate for these advanced technology lenses and you trust your doctor in making that recommendation, we don't want to offer you a lens that we don't think it's going to deliver on the promise that we want for you. We all want happy patients. And so when I feel really excited about a patient's profile, ocular profile, and I feel that they can really reap the benefits of a multifocal lens, I can tell you I would want a multifocal lens in my eye, light adjustable lens in my eye. I would want definitely an advanced technology lens in my eye. I want the same for my patients. I want them to have great results. So if I feel that a lens can deliver on that promise, and it matches their priority and what they hope for from surgery, then that's magic, and that will result in fantastic outcomes for our patients and that hug factor that you brought up. But I want to just close by saying it is important for patients to come in knowing what their priorities are, but it's important for them to know that we can't always deliver on the outcome that they hope to have. So the eyes need to be healthy. We need to make sure that we really check and make sure every layer of the eye is optimized or able to really be able to deliver on the outcomes that an advanced technology lens. But come in with that information so that we can understand how you as a patient use your eyes and what are your priorities. Then it can help us better recommend the best lens for you.